All right, so today's lecture focuses on friendship and socializing. Most of your readings actually focus on friendship and socializing, so one of the new things that I'm going to touch on in this lecture is also alcohol and substance use. So in terms of friendships, the strength of ties has a really big impact on their effect. So friendships can help people in crisis and decision-making, and often, particularly for emerging adults who have moved away from home, friends can take the place of family. So in terms of a social network, your readings kind of emphasize the importance of that. But social networks can be used to connect with future employers, expand interests, and provide emerging adults with newer opportunities. The size of the network has a big impact, so how many people you have contact with, even if it's just casual contacts. The position that you have in the network is also important. So are you central, meaning you have a lot of close ties to a lot of people, or peripheral, meaning that you're in kind of a group that you have a tie to one or two people who may be connected to others. And generally what we find is that people who have a lot of close ties tend to be better connected to jobs, they have information, they actually have more healthy behavior and better income. One of the biggest points of change in friendship is the college transition. So there's a lot of research on how friendship changes. So this was a study looking at first-year college students at the beginning and the end of their first semester. And what they found was that in the beginning of college, high school best friendships predicted emotional adjustment. However, later in the semester, at the end of the semester, their new college friends were more important in adjustment. And actually, alienation from peers or separating from current peers was associated with poor academic and emotional adjustment. So high school friends are important early on, but later on it's really college friends that predict well-being. This is looking at relationships between organized activity involvement, loneliness, and friendship quality during the transition to college. And they looked at people the summer before their first year of college and then 10 months into their first year. And what this graph is showing is that, so this is the amount of intensity of activity, extracurricular activity involvement. And what they found was for people who had a lot of loneliness and dissatisfaction at the beginning of college, who were very intensely involved in activities, they actually developed higher quality friendship. So basically, if they're having a hard time going into college, getting involved in activities can be a big help in terms of improving friendship quality. This is from the same study. Again, this is looking at intensity of activity involvement. And what you can see here is if you had low friendship quality before college, if you have high intensity activity involvement, then you're less lonely later on in college. Whereas if you have low friendship quality going in and aren't super involved in activities, you still have high levels of loneliness and social dissatisfaction at the end of your first year. So what this suggests in combination is that spending a lot of time in activities is more beneficial for emerging adults who have poor social adaptations. Okay, this is from an interesting study looking at the importance of friendships versus romantic relationship quality on becoming an adult and on identity development. So they looked at emerging adults 18 to 26. They looked at identity achievement, and then they also looked at achieved adulthood criteria, which included things like independence, family capacities, norm compliance, age transitions, and things like that. And what they found was that high-quality romantic relationships were associated with better identity achievement and more adulthood criteria. So basically, higher quality romantic relationships makes people feel more adults. In contrast, friend quality doesn't predict identity achievement. So emerging adults who've met more adulthood criteria actually have poorer friendship qualities. So there could be a couple of things going on here. Friendships may be less useful once you reach adult status, whereas romantic relationships become more important when you have met all of these adult milestones. Or it could be that once you've met these adult milestones, you focus less on friendships in favor of focusing on romantic relationships. Either way, we see this kind of shift away from the importance of friendships as people are reaching adulthood. Okay, so shifting to drinking, one of the big kind of questions that's been tossed around for a long time is, should the drinking age be 18 or 21? And there's a fair amount of evidence on this. what we find is that short-term, a drinking age of 21 is particularly good for reducing alcohol consumption and traffic fatalities for those under 21. So it really protects the younger people. So the way they looked at this is what happened. So in the 70s and 80s, drinking age was determined by states, and when the drinking age was lowered, there was a 10% increase in alcohol-related traffic crashes, whereas when the drinking age was increased, there was a 16% decline in traffic fatalities. However, a lower drinking age is not linked to long-term alcohol consumption in adulthood. But what we do see is with a lower drinking age, so drinking age of 18, there's more frequent binge drinking, but not as much impact on non-heavy drinking. So the slide says the flip side, with a higher drinking age, there's less binge drinking. And finally, men and people who didn't go to college benefited most from a higher drinking age. We'll talk a little bit more in a moment about college versus non-college emerging adults and drinking. Okay, so this study was looking at, is it just drinking early versus getting drunk early? That's more important in predicting alcohol problems. In this case, they looked at to the end of college. So they were looking at age of onset versus the delay to first intoxication. So once you start drinking, how long until you actually get drunk? And what they found was that early onset and a quick progression to intoxication are both important predictors of drinking problems. And so what you can see is people who have earlier onset have a greater delay to intoxication. So if you don't drink until age 20, you're more likely to immediately start drinking and get drunk in a very short period of time. So this early onset, I guess the good thing is they're not getting drunk immediately, but they are still drinking, and we do see the early age of onset is related to family problems and impulsivity. Okay, so this is one of the studies looking at the drinking pattern for college students who were age 18 to 19. These were people who reported drinking before participation, so they were already drinking, compared to emerging adults who didn't go to college over the year. So the solid lines are students, the dotted lines are non-students. And it's important to note that this only includes students who are already drinking, so this is an average rates for students. And in general, what you can see is the drinking levels and patterns across the year don't really differ much between college versus non-college students. Both seem to drink on similar schedules. There's one kind of weird thing, this holiday right here, Guavaween, is a holiday in Tampa where the sample was collected, so there's a lot of drinking going on in that specific location. This graph doesn't show it, but the study also looked at the days of the week, and generally drinking is lowest Sunday through Wednesday and increases to a peak on Saturday, and this is again true for both college and non-college students. This is another study looking at college versus non-college emerging adults, and this actually found slightly different results. This looked at at emerging adults ages 22, and what they found is that college students actually seem to drink more than non-college students. So one thing they know is associated with drinking is low self-regulation and high sensation seeking. These are risk factors for drinking, and college students tend to be less likely to have these things. So these figures are when you take into account these personality factors. So these are looking at an individual with the same amount of self-regulation and sensation seeking. If we control for that, you're much more likely to drink if you're in college versus not in college. So there's some evidence that college students are much more influenced by the perception that members of their social group is also drinking. So non-college students are not as influenced by the perceptions that their peers are drinking, probably because they spend a lot less time in large social groups than college students do. But the important thing to note is although non-college students in general drank less, non-college students were also more likely to have alcohol-related problems, so things like fights with friends, hangovers, and missing work because of alcohol. So very different effects going on here. maturing out of alcohol use, there's this theory basically that individuals use alcohol a lot in their early 20s and then kind of mature out of alcohol use after their 20s. And so this is looking at how self-perceived maturity influences alcohol use at ages 25, 29, and 35. And what they found was that at 29 and 35, but not 25, individuals who have alcohol use disorders report feeling less mature. So alcohol use problems is considered more age appropriate at 25. If you're still using alcohol a lot at 29 and 35, the assumption is kind of it's because you're feeling immature, you are immature. So the mid-20s seems to be kind of this window where high alcohol use is unrelated to maturity. Everyone's using alcohol. Afterwards, that decreases. And across all ages, they found that people who are married have fewer alcohol use problems, and parenthood and employment were unrelated to alcohol use problems. This study is looking at the overall decrease in alcohol dependence throughout emerging adulthood. And so this is kind of one explanation for the maturing out of alcohol use. However, what you can see is persistent rates don't change. So basically, once you have an alcohol use problem, you typically have it throughout the lifespan. But where we do see changes is in new onset and recurrence. So there's fewer people developing new problems or having recurring problems, and this is associated with the declining rates of alcohol dependence. One thing that they did find was associated with a new onset of alcohol use is the onset of parenthood and also changes in employment status, and this was true regardless of age or gender. Okay, this is a study looking at people who might be particularly susceptible to alcohol or drug use, and this looked at sexual minority youth who identify as sexual minorities at various stages in emerging adulthood. And what they found is those students have more dramatic increase in alcohol and marijuana use during college. The hollow points indicate a sexual minority. So wave 2 was early, identifying as a sexual minority early on, whereas wave 8 means identifying as a sexual minority towards the end of college. And then the squares are men. And so you can see that in general, men always drink more than women, but also sexual minority youth on average drink more than sexual majority youth. But the pattern is less true if they identify as a sexual minority later in college. So the problem really seems to be with those early identifiers who are probably maybe having adjustment issues. Okay, so this is looking at non-medical use of prescription ADHD medications, so things like Ritalin and Adderall. This was an internet-based survey looking at adults from 18 to 49. So this is looking at the prevalence in the past year. So among ages 18 to 25, the prevalence was 4.3%, whereas if you look at the entire span, it was only 2%. So definitely higher in emerging adults. Most used these drugs multiple times, and use was predicted by whether they could access it or not. And the most common source was a friend or family member. In terms of motivations for stimulant use, the most common was to be productive or to stay awake, which are obviously issues college students are going to be dealing with. And then they're often used in combination with other drugs or alcohol. So these are the other drugs that individuals are using, and you can see that one problem seems to go with another. So that's kind of a little snapshot of alcohol and drug use in emerging adulthood. And that's it for this lecture.